Hello, my name is Ellen McIntyre and I'm the Director of the Primary Healthcare Research and Information Service, and we are pleased to introduce you to the new Primary Healthcare Search Filter. If you're involved in research, policy making or practice, you know the importance of having access to the latest literature. We all know that the literature available is growing exponentially. PubMed currently has over 21 million records. With the Primary Healthcare Search Filter, all the hard work has been done for you. In collaboration with Flinders Filters, the search filter was developed objectively, tested and validated, and retrieves PubMed citations with optimal efficiency. Accessed through the PHCRIS website, the search filter has two main features. You can use it for one-click search on a topic or build your own topic searches. Choose from these topic searches. This will refine your results to your area of interest. I've chosen the topic Chronic Disease Management. For a one-click search, click on Chronic Disease Management, which links directly to PubMed. It lists all 6,931 citations around primary healthcare and chronic disease management. Going back to the search filter start page, you can choose to refine your search further by selecting one of these options. I have selected to refine my search to Australia only. In this case, only 460 citations were returned. The next option available to you is to build your own search. The topic searches are still available, but in this example I won't use them. I will enter my own keyword, integration, and limit the search to free full text and Australia. By clicking search, you are directed to all the relevant articles in PubMed. At this time, it lists only 59 citations around primary healthcare and integration, limited to full free text and Australia. To ensure you get the most out of the search filter, we have included a number of help topics. You can explore these here. Further information is also available, including options to subscribe and provide feedback. With the continual growth of the literature base, filtering to what you need is becoming harder. The Primary Healthcare Search Filter helps you with this. We anticipate the filter will be enhanced over time to keep aligned with changes and needs of the primary healthcare sector. We encourage you to let us know what your needs are. So what should you do now? Well, jump online and explore the filter. And remember to subscribe for updates. And please send us your valuable feedback. It's important to us. So thanks for watching. And now jump online and see how the Primary Healthcare Search Filter can work for you.
So why a search filter? What underpins those searches I showed you before is a search filter. And that's basically an evidence-based search. So it's not an expert search, it's not a search by a health librarian, it's a search that's developed by research. And therefore it has a known effectiveness. We know the percentage of material we're going to retrieve using that. So there are many benefits from the search filters. It obviously saves time. It's going to increase the likelihood of getting better quality retrievals. It's going to reduce your individual search burden. You're not going to have to struggle with all those interfaces. It embeds the technical expertise that is required to actually get a quality search result. And importantly, it facilitates knowledge translation. If we can't find the knowledge, we can't use the knowledge. What's involved in building a primary healthcare search filter? So the process we followed were these 6, and I'll just quickly outline what was involved in each of these. The first was a scoping study. What we actually did was we took a document that had been developed by PHCRIS on looking at the literature for one of the submissions they did, and it helped us understand the nature of the literature base that primary healthcare deals with. It also brought up some definitional boundary issues. What is primary healthcare literature? What isn't? Where's preventative health sit? What's community health services in this arena? All of those elements. And it enabled us to look at what we would consider as gold standard options. We needed a set of data against which we could compare the retrieval. We had an expert advisory group, and that had several important roles. One was to actually make sure we defined the study parameters, so we stayed within that and delivered on it. It was to help us with term identification and term priority to make sure that we could think about what were the unique words that described the literature we were looking for. It had to choose what was the most appropriate gold standard, and we looked at a range of them. So when you're looking at something that you want to check how well did you retrieve that, you need to have something that is representative of primary healthcare literature. Some people have used gold standards, so a search of journal articles. Others have looked at systematic reviews, guideline sets, subsets of journals. So there was a range of ones that we put forward, and we asked the expert advisory group to help us. And also we had a post hoc relevance assessment, so the idea that they would actually ensure that what was being retrieved was functionally and clinically useful. So the gold standard had to have a couple of characteristics. It has to be representative of the literature, as I mentioned, and it had to be available on Medline. So we did decide on a gold standard set, which was 10 systematic reviews that had actually been developed through the AFCRI process. And what we did was we extracted all the references from those that were on Medline. That ended up with being about 526. We divided it into 3 sets that we used for term identification, for the actual development of the search filter, and then a clean set for the validation of the actual retrieval amount for the search filter. So what's involved in filter development? Well, basically we take all the over Medline articles. We divided them in the 3 sets. The first thing we did was we took the term identification set and we ran a frequency analysis to find what were the mesh terms and what were the text words that were most frequently occurring. And then we weighted those and we started to combine them so that we were looking at all the combinations that could be there to see which one retrieved best the set of articles that had been seen to be relevant to primary healthcare. And so in the OVID Medline, and we use OVID Medline because it has some characteristics about how you can control the mesh terms and the text words for searching, which is quite technical, so I won't go into it. So we ended up with a 78.5% retrieval of the set of articles. And this is what it looked like. So this will give you an idea of the type of concepts that are embedded there. The .mp means that they're a text word, and the other ones with the slash mean they're mesh terms, non-exploded mesh terms. We also wanted to look at the question of PubMed. Now, PubMed's related to OVID Medline, but it's got a couple of important different characteristics. The first thing is it's open access and it's free to use. So that means you don't have to have special rights or have purchased rights to it. The other thing is that you can access it through hyperlinks, and that means we could put these filters on the web and enable you to click to get where you wanted to go. To do this work, to get it into PubMed, we had to undertake 2 further studies. One was an equivalent study of the index sets, so the work that we'd done in OVID Medline, we checked that we got exactly the same results in PubMed. The other important feature of PubMed is it has a non-index set. So this is a set that might be of the work that is actually about to be indexed, so it might be the most recently produced material, therefore it might be the most material you're most interested in. So if you're running that with an index set term only, you'll miss it. And we had to do a technical study called the missing items study to actually be able to capture that material. Then we combined the 2 of those to create what we called the PubMed primary healthcare search filter. And so that gave us the capacity to then look at how did we build that into a URL with a message that would enable it to push it out to PubMed to run the search automatically.